Saja Brito, and this is News Review. Coming up, Higher Education and Finance Ministry roll out plan for tertiary education students in the Gambia amid COVID-19. We also had an exclusive interview with the Director of Health Promotion and Education, Mr. Modunjai, who discussed some of their biggest challenges in the fight against the novel coronavirus. But first, let's take a look at the newspapers. We will start with the Standard newspaper today. Standard is reporting that COVID-19 patient denies testing positive for coronavirus. And of course, National Assembly member says Barrow should be impeached and state given 14 days to file murder charge or release a suspect. And of course, the bigger headline, 3 years Jotna founder breaks silence. Let's take a look at some of these stories in detail. 3 years Jotna founder breaks his silence. The founder of the now proscribed 3 years Jotna movement, Musa Kote alias King Sports, has broken his silence since his Gambia-based executive members were released on bail after a month-long incarceration for unlawful assembly, among other charges. In a rather conciliatory tone, Kote told the Standard newspaper from his base in the United States that his movement is not dead, but events such as the coronavirus pandemic have forced them to put their planned activities on hold. When asked whether this is not a good time to entirely bury the hatchet and move on with something else, Kote replied, "Our silence doesn't mean that we are done and gone. 3 years Jotna is still functioning very well, and President Barrow, as far as we are concerned, is not our president because his promised 3 years mandate is over," he was quoted as saying. COVID-19 patient denies testing positive. One of the 5 people reported by the Ministry of Health to have been tested positive for COVID-19 last Saturday has denied having the virus. The Health Ministry last week announced that the country has registered 5 new cases of the novel COVID-19, but one of the 5 cases has released an audio obtained by the Standard newspaper in which the person claimed, "I am not having coronavirus and they want to give people corona so that they can make money from it. What surprises me is that there were 47 of us and we were all mingling. Now they want to say that only 3 of us tested positive." National Assembly member wants Barrow impeached. The opposition Gambia Democratic Congress National Assembly member for Jimara has urged fellow lawmakers to institute impeachment proceedings against President Adama Barrow. He was quoted as saying, "I believe President Barrow doesn't have the competence to lead this country. He is not inspirational at all, and I think the COVID-19 outbreak has exposed his lack of leadership quality." Alaji Sow, who is representing the president's native constituency, told the Standard newspaper. And of course, the state given 14 days to file murder charge or release a suspect. Justice Ibrahim Jaita of the High Court in Banjul has ordered the Attorney General and Minister of Justice to file a bill of indictment within 14 days or unconditionally discharge one Saliu Jawara from custody. Justice Jaita made this declaration last Wednesday, 8 April 2020, in a ruling on a bail application filed before the said court. UNDP donates minibus to prison officials amid COVID-19 crisis. United Nations Development Program, UNDP, has recently donated a minibus to the prison officials to improve the conditions of the prison in the fight against COVID-19. The 30-seater Nissan 2019 model was handed over to the prison officials at the UN House in Bakau. And of course, ECOWAS donates medical items to the Ministry of Health. The ECOWAS West Africa Health Organization Thursday donated consignments of medical items to the Ministry of Health to assist the country in its fight against COVID-19. The donated items included chloroquine and of course some PPE test kits. That's it for the Standard newspaper. Let's take a look at what the Point has for us. The Point newspaper is reporting that immigration impounds over 20 motorcycles, 2 trucks used for smuggling. Let's take a look at that story. As security intensifies surveillance against any suspected smuggling across the borders of the Gambia amid COVID-19 lockdown, officers of the Gambia Immigration Department in Farafenni have impounded over 20 motorcycles suspected of smuggling people despite the closure of the border. The Point newspaper has been reliably informed. That's it for the Point newspaper. We will go for a short break and then we'll be right back. Welcome back. Weeks after the Ministry of Basic and Secondary Education rolled out plans for students to continue their classes virtually, the Ministry of Higher Education, in collaboration with the Ministry of Finance, has joined in to make sure learning continues for university students and other tertiary institutions. Just like many higher learning institutions across the world, university officials believe it was necessary for them to come up with an alternative. Here is an excerpt from the press conference.
The management decided to come up with an alternative method of teaching because, as you know, coronavirus is really changing our lives to some extent. And should we sit down and watch or decide to come up with a response? Like many universities, we decided to go online and using the different platforms that many universities are using. And based on that, the task force was constituted and the Senate also met and approved, green line given, to now start first use our ERP system and then also use Google Suite. That will help the lecturers and students to have Google Classroom. And with that, the opportunity is you can have live classes. People can watch, can see you, can ask questions. And then on top of that also, it is recorded. So those who missed the class will have the opportunity to watch the video again. And even those who attended the class have the opportunity, maybe the lecturer was very fast in his explanation, to now go through the video over and over and be able to have a general understanding. So this is one of the options. The other one is also making sure that it is available, and that's how the ministry came in and really helped to negotiate with the GSM operators to make sure that at the end of the day, this tool that is for the online lectures, okay, is free of charge. So therefore, students will now have access to Google Suite for this Google Classroom free of charge, and it's unlimited. So they can use it over and over. We've already sent their details to the GSM operators so that all the registered students can have access to that and without any problem. The other thing also is they would want internet for their private research. That's when good government and the university management decided to provide the students with 1,500 meg for their individual research, different from the lectures, because the lectures is free. Anybody who is a registered student, your data is sent to the GSM operators and they synchronize the system so that you can have access to, when you log in, it will not consume your data. So that's what is done. So the 1,500 meg is for their private research. On their own, they want to do something and so on and so forth, but not the classes. The classes throughout these 6 months is going to be for free. And then now we thought of the lecturers, so all the lecturers will be given internet bundles, data cards, so that they can have unlimited also internet for their lectures. So this is what we plan to roll out.
Thank Sister Ministry or our key stakeholder, Minister of Higher Education, for this unprecedented efforts they have done, which is something being emulated globally, that despite the pandemic is going, education still has to go. And we want to commend them for doing that. Being the case, we have been working with them, as been highlighted by the PS, that the Minister of Finance have been working with them, with the GSM operators, how best can we accomplish this mission. And as far as Minister of Finance is concerned, we have already supported the process, that this process is going to be supported in the period of 3 months, as been highlighted by the permanent secretary. And we all pray that before the 3 months, it will all vanish. So what we propose is, financially, we're going to pay $70 per student. $70 every month per student of all across, of all the students in the UTG, whatever, all the tertiary institutions being registered by the GSM, we're going to pay $70 per student. This is what we have agreed for the period of 3. So this is why it is free. In the same, I will also take this opportunity to extend the ministry's support still now, as far as the higher education is concerned, beyond the borders, and that is students studying abroad. We also prepared to continue their funding, both their feeding and their tuition fee, of which logistics have been going to be worked out with the High Minister of Higher Education, and funds will be provided. Another support we are having is not only those funded by government abroad and being tuitions being paid, but those students who are also self-sponsored, sponsored by parents and others outside the borders of the Gambia, we are also looking to see that they have been supported. And currently we are working with the Minister of Foreign Affairs on all the statistics to make sure that those students also are supported.
TAF Africa Global is proud to launch the Moria Gardens, conveniently located in Bruford, 5 minutes off the Bruford Highway. Moria Gardens is set to comprise of 20 fenced and gated service plots with sizes ranging from 264 to 420 meters square. Unique features include water and electricity infrastructure, solar street lights, all-weather roads and scenic gardens. We offer a 10-year mortgage plan with a 25% equity down payment in partnership with GT Bank, Trust Bank and EcoBank. For more information, please contact 376-2333 or 776-2333 or visit our offices at Madiba Mall at TAF Bruford Gardens, opposite 5-Star Hotel.
Welcome back, and now we will end today's review with an interview that we had with the Director of Health Promotion and Education, Mr. Mamadou Njie, who discussed some of their biggest challenges they face in the fight against COVID-19. Let's take a look. Days after Gambia seemed to have flattened the curve on the number of COVID-19 cases in the country, the Ministry of Health on Friday announced that there were other 5 new positive cases, 2 of which happened through transmission. And today we sit with the Director of Health Promotion and Education, Mr. Mamadou Njie, to discuss how really Gambians are taking this pandemic. Mr. Njie, welcome to the Fatu Network.
Thank you very much, Sergio, and thank you also for coming to my office and also taking the time this public holiday, coming to see and discuss with us and to get information with regards to COVID-19 in the Gambia. Basically, what we have seen, that's what we have been talking about since the start of the pandemic. We've really emphasized to the public that we should be mindful of local transmission. We should be able to report people who either travel to hotspots areas or affected countries. And then, but interestingly, people were hiding those people who came, and that they came through other means. And then they also went to households, they went to families, and the family members are the one who were keeping them. And then that has been a challenge for us. And also the other challenge we have is the issue of denial. People think that they sit around and then say, well, okay, this doesn't happen, it's not true. That is a big challenge for us.
There are so many conspiracy theories surrounding this. People actually think this is some sort of world politics that is happening right now.
That's what we are trying to battle with regards to trying to clear the minds of those people and to put the facts to them, and to say that as long as they are seen on television on a daily basis that people are dying in the affected countries, I don't think they should be complacent with whatever we are seeing now. And then our emphasis is that people should definitely believe that the disease is with us. It has come close to us before, and then now currently with us. So what we need to do now is to redouble our efforts. How do we redouble our efforts? We need to make sure that we adhere to the implementation of the measures, the public health measures that have been put in place by government. Those measures should be definitely adhered to by everyone, especially the social distancing, as well as also the implementation of the suspension and public gatherings. This is something that if we don't do that, as a country, we are leading ourselves into a different scenario. And before we get into that scenario, I think it's important for people to understand what we are talking about. We have been sending out messages, but also most of our messages have been seen by other people as not relevant, and also they believe in social media, and that has really given us a lot of time to counter some of these fake news, and also to identify rumors and respond to them when they occur. This has been a challenge for us in the Risk Communication and Community Engagement Subcommittee, but nonetheless, we got the support and cooperation of the media, and then anytime we are able to counter these rumors, we are able to send out either the press release to the media, and they also helping us to disseminate the information to their audience, which is something that is, we also want the public to understand that the disease is real, and they must have to do all sort of measures to ensure that we stop the spread of the local transmission. Although we have 2, but I want to appeal to the public to at least for us to stop at only 2 for now. Otherwise, we might find ourselves in a problem. We have to talk about the realities, and we have to speak at the hard talks. And then basically, what we want to emphasize to people that the measures or the suspension on public gathering is not by any means any political means. It has nothing to do with politics. It's a public health measure. In public health emergencies, you have to come up with public health measures according to the International Health Regulation 2005. One, if the disease is easily spread, what you need to do now, especially when it is through contact, what you need to do is to ensure that people avoid being close to each other, or try to avoid contacts, or to live in crowded areas. This is a public health measure. Even, for example, tuberculosis. It's a similar one. Like, for example, somebody have some of those diseases, we have to separate people from the public. So what we are doing now is it has nothing to do with politics. It has nothing to do with government policies to punish each and anyone, but it's about implementing the measures with regards to public health. That is what people need to understand. And we cannot effectively implement public health measures without the participation and cooperation of the general public. That we are asking the general public, you being a shopkeeper, being a fisherman, being a whatever you are doing, whatever business you are doing, you're a religious leader, community leader, influential leader, youth group, or youth organization, or youth, we want all of them to work together. We ensure that the measures are fully implemented, so that we ensure that at least we stop the spread of local transmission. That is our fear, and our fear when we don't adhere to the measures that have been put in place by government, we are also trying to give room to the spread of the disease at local level, and this is what we need to avoid, Sergio. 2
positive cases transmitted through local transmission, as we call it.
Sure.
Which begs the most difficult question, Mr. Njai. Do you think there could be more undiscovered cases?
There could be, yes, because what I say, the attitude of the people, I mentioned at the beginning of my discussion, that people are trying to hide people who have traveled to affected countries. And if we are to help ourselves, to help the Minister of Health staff or partners, or to help the government, we are not supposed to hide anyone that has traveled or has a history of traveling to affected countries. That is a big challenge for us. And then, as you know, our 1025 has been used to track these people who came, who traveled, and who had a history of travel to certain countries, and they've been put on quarantine. And when they were quarantined, they have been tested, and as a result of the testing, most of them were positive. And I think it's important for us to regard whatever message the ministry is sending. Let the public not counter what we are sending out. Let them instead support us, work with us, for us to be able to disseminate appropriate, timely, and efficient information to the general public. We really want that thing to happen, but we cannot do it without the cooperation of the general public. We want their support. We are asking the support of the general public. When I mean general public, we want everybody to work together with us and to adhere to the measures that have been put in place by government, like the issue of social distance. Sergeant, you'll be surprised, even in certain communities, we just returned from community visits. Certain communities are still conducting programs like marriage ceremonies, wedding ceremonies. So meaning that they are trying to challenge government, regulations. And I think it's a regulation, it's a law. Now what we need to do now is to work with our other partners to enforce the laws. We're going to go in for enforcement. At the beginning, we thought when we talk to the people, they will understand. We thought when we have dialogue with them, they will understand. We also thought that by also engaging them, they will understand. But now we are seeing a bit of resistance. People are now resisting to our message. Our messages were very much appropriate, very timely, and also messages that were being sent out doesn't cause any havoc to the population. Whereby you can say people are resistant to our message because it has something to do with them, it is affecting them. But our messages have been very clear to the public, and what we have been sending out is that we want them to adhere to the measures and also to ensure that they participate in the fight against the pandemic. But we are seeing a different trend. The things like they are trying to resist to our message by trying to do what they feel is okay with them or what they feel is appropriate for them and their communities. That is by violating the regulation. And I think this is something that we are not going to compromise. The Minister of Health will work with its partners. As you know, the National Health Emergency Committee and also followed by the various subcommittees, like where you have the logistic and security, all the committees are multi-sectoral, and we have all the sectors in that committee, and we are going to strategize as to what do we need to do. And the next step is to ensure that we start enforcing. That's what we're going to do. And then we don't want to force people to at least stay home or to because we are saying you have time to do business. You have time to go to the market. After the market, please go home and avoid interacting with many people. That's the message is very, very simple and clear. What we did to people now to accept our message and implement it. But now if they don't want to implement the message, we are going to apply the public health measures. And the public health message is showing that we're going to shut down certain places, which we don't want. But now, like for example, when restaurants are asked not to operate, bars are asked not to operate, and in some areas they are operating, meaning that they are going to go against the law. So we don't want people to go against the law. If you go against the law, you are going against your own health, because if we are here to protect public health. In protecting public health, you don't need to compromise. So we are not compromising with the safety of the people with regards to their health.
So in general terms, how would you describe the effectiveness of the state of public emergency? It's like social distancing is at an all-time zero right now.
It may not be zero. Some communities have adopted the issue of, they've adhered to it. Some communities are really doing well. And then when you come to congregational prayer, some communities have gone away there. They are not doing it. They are also avoiding. I remember we went to one of the communities yesterday on Sunday. We went to one community, and they told us that that was a funeral. What they do is like if they're going to do the burial in the morning, they will just tell people, or they're going to do the burial in the afternoon, or maybe they will just tell people, they'll just inform certain people the burial is going to be in the morning. Some will be informed that the burial is going to take place in the afternoon, so that many people will not meet at that place. So that's a good strategy. A good innovation. We also went to certain committees that they sort of what we call the committee vigilantes, which are the youth, comprised of mainly youth, and they have been asked to monitor border activities to ensure that they monitor people who comes in and out of the community. So these are things that we cannot say that we cannot generalize our statement, but we can say some communities are really adopting and adhering to the measures, but some are really definitely we are finding it very difficult to accept and also adhere to the measures, which requires a lot of work. The media, I would say, you and I and others have a role to play by also talking to the public and also having one-to-one discussion. And that, if you look at our risk communication and community engagement, that is the strategy we have taken. We know we have been talking to the people on the media, we've been discussing with them on the media, panel discussion, live phoning programs, and even sometimes certain discussions. But now we said, why can't we now move, identify, we need to now first identify and map out areas we are having challenges, and now we start meeting those opinion leaders and influential leaders one-to-one. And this has really helped a lot. And that's what we're going to continue.
How has testing intensified so far?
Testing has been intensified because, as you know, we have the required test kits, we have the required personnel. Right now, you've seen the number of lab personnel who are also on the sort of refresher training. And then we have this on a weekly basis so that the people who are collecting samples and doing the testing, all the capacities are built. So we have this personnel, and then we have the people who are also going out to do the sample collection and then also sample transportation, as well as also facilitating for the samples to reach to MRC for analysis. So it's been intensified, and then now people are concerned, and then we're also happy that these 2 days people are now coming to call, and then even in fact informing us as to the presence of certain people in certain communities and certain households. This is also very helpful. Now, meaning we have seen in the trend we have seen during the report, of the first case, you can see the number of calls have increased. But also, after 2, 3, the third case, after the fourth case, the calls drop a bit. But now, as of Friday, the calls also increase again.
Could it be because it was local transmission?
Yeah, maybe also people now saying, now we are serious. We had 4. We thought we were going to stop at 4. Now we have additional 5. So meaning we need to take action. Now they are calling to ask, what do they need to do? So our people are really working very hard to explain to them, for them to adopt and adhere to the public health measures. And I think that's the only thing we need to do. We need to avoid being together. We also adhere to the rules on social distancing.
What other plans does the Ministry of Health have in case the numbers rise, which is highly likely, Mr. Njai?
Okay, thank you very much. I think basically the ministry at this point in time has a plan to make our national public health laboratory functional to be able to test COVID-19. Our staff are the one doing together with MRC, they're doing the testing, but now we want to operationalize our own facility, which is a BL3 lab, which can also be able to do that. So we're waiting for certain equipment. Most of them have now come now, and I'm sure in the next 2 weeks, we should be ready to operationalize testing from the central level down to the regional level. That is the plan. I think it's already, in fact, it's almost on high gear. And then I don't want to give you a specific time and date, but right now a technician and our people are working together very hard to ensure that we institute these testing facilities. In addition to that, we also have thinking of now having treatment centers. Instead of only relying on one in the venture around the sanatorium, we're going to have, every region is going to have a treatment center. And then plans are also underway. In fact, all the procedures have been done, and now we almost work on it, and all the facilities. And now also, if you look at all the facilities also have isolation centers, which is also good, because then we didn't have those. But now we have, when we reported the first case, we make sure that all the facilities have isolation rooms. And these are also available. So you can see we are moving towards. It might be slow for certain people, but health is just like a step-by-step approach. We don't rush on certain things like this. We have to take our approaches. We are knowing that we want the ministry, under the leadership of the Honorable Minister, Dr. Samate, really want to ensure that we strengthen the health systems. Even after the COVID-19, then we should be able to have a robust system where we can also be able to detect certain diseases at level, and that is what is the purpose of strengthening the laboratory at central level and regional level, and also strengthening all our health facilities, and also to ensure that our facilities also still have functional isolation centers as well as laboratory facilities. So these are things that we want to do, and then we are really working on it. If you remember, most of the facilities have been upgraded from major health centers to district hospitals, and then they are not even only upgraded, but they've been operationalized with the required medical staff on board. So I think gradually we'll be there.
This fight requires a lot of equipment and a lot of personnel.
Yep.
How many ICU physicians or consultants do we have right now? At some point, they will need to be quarantined. And of course, do we have another team with the same level of competency to take over when that happens?
The physicians Sergio, I will not be able to tell you the exact number, but what we have on the ground at the moment, we have the required people who can also be able to do the task accordingly. We also have, as you know, like right now at the sanatorium, they are working on a basis under the supervision of senior consultants and senior doctors who are our own Gambian doctors. And then, here among them, I would say Dr. Bouaka Jain, and he has a team that he's working with, and then they are working as a team very well. And then the same thing is going to be, in fact, what they are planning is to have a similar team in all the regions, and now that has also started. So what we need to do now, whatever structure we have at the national level or at the central level, we're going to have similar structures supervised by senior people, senior consultants at the level of the region. So, Sergio, if you know our system, it's a bit complex for certain people who may not understand, but what we are really far ahead of many countries in the sub-region, because our activities are not that COVID-19, but since day one, we've been trying to strengthen our health system. And then if you talk about health system strengthening, you also think of having the required human resources with the required capacity. And that is, we still need more capacity, more human resources, but what we have for now, I think they're also doing their best, and they're doing what is expected of them. So we also need more, and then the more staff we have, the more experts we have, it's going to be welcoming. So that's a welcome. But at least as of now, we will not say that we don't have staff, but we have people, personnel on the ground.
And so far, how is the border closure contributing in the fight against COVID-19?
It affects some families economically and socially, and certain people feel that their movements have been limited. But that is, as I said, that is about public health. Public health, you don't compromise. And the international health regulation, if you have to implement it, you don't need to look at each other in any other person's eye. You have to implement it according to what it should be done, so that you can also be able to reduce the spread of the disease. And as you know, we are into local transmission, so we should do all efforts to ensure that we stop the transmission. We have to. We don't want to go further. What do we need to do? We need to strengthen our public health measures. The borders are still closed, but people are still coming in and out one by one. And what we are doing on these community vigilantes to be set up by communities is also going to help, because these are the people who are roaming around. I'll give you one typical example. Sabi, we went to Sabi. Sabi in URL has about 8 exits. From the village, you have about 8 exit points to the border villages in Senegal or in Casamance. What they do, the VDC was able to mobilize the youth, and they got about 8 motorcycles, and these are to be manned by 2 people. So anybody that comes in, they make sure that you don't enter into the country. And if they enter, they have to take them through the appropriate, the recognized border point. And that is, at the recognized border point, or the point of entry, you have immigration, you have police, you have the health, you have GRA, you also have SIS. And these are also people working very, very closely. And then whenever the communities have any challenge, they make sure that these people are involved and they support them. We want the communities now to be open. We also have seen that in certain border communities there is this cross-border collaboration. That means Minister of Health, the health authorities and the health and security authorities in Gambia are working very closely with the health and security authorities in Senegal, and they do what we call cross-border sensitization and also cross-border engagement of village heads in those communities in both Gambia and Senegal. This is a very good practice, and we want the communities, all the 2 countries also to continue doing implementing such a good strategy. And I think also if we look at what we're also doing at the border, also like our teams are also going to doing one-to-one or community-to-community sensitization, just to reinforce on the messages that have been sent out earlier on. So I think, Sergio, when we continue doing what we are doing, I think we should be able to limit the number of people that are coming into the country, and also to contribute immensely to the reduction of transmission within the communities.
And of course, finally, I know that the world celebrated World Health Organization. It was a rather quiet one this time in the Gambia and all over the world, but I just want to take this opportunity to say thank you to the frontliners, yourself, the health minister, and every other person in the health wall helping in the fight against COVID-19. Thank you very much. And finally, your final word to the Gambian people.
Thank you, Sergio, and thank you for recognizing our effort. But we also want to recognize the efforts of the media, especially Fatu Network has been working with us and has been contacting us for information. we have to thank you also for the time and energy that you've taken to come and discuss with us. And then my message to the general public is that we should continue the practice of hand washing at regular times. We should also adhere to the public health measures. We should also avoid being together or living in crowds and practice social distancing. We should all adhere to the suspension on public gathering. In whatever form, I want to appeal to the general public. I also want to appeal to the governors, mayors, councillors, village development committees, to continue the good job they are doing, but also to be vigilant of whatever is happening within their areas. That's also going to be very helpful. We should also continue to raise awareness and to engage the religious leaders, the opinion leaders, district authorities like chiefs and akalos. We want all of them to work together, and then we want so that we can also be able to fight the disease. Finally, I want to appeal to all the political leaders to come together and fight this disease. Let's forget about our political ideologies. Let's forget about our political differences. Let's just come together and fight this battle. When we win it, then we can all celebrate together. It is not only the Minister of Health that can fight this disease, but we want the collaboration of the private sector. The private sector is doing a lot of work through GCCI. We have seen what GCCI, the initiative they've taken. We want all the private sector organizations to support GCCI by donating whatever amount you can have, so that GCCI can also be able to help the health ministry as to whatever our needs are. Let's forget about rumors. Let's not listen to social media. Let's not listen to fake news. If anybody wants information, we want to appeal to you to contact the Minister of Health directly or call our 1025 for more information on COVID-19. On that note, I thank all of you for listening.
Thank you very much, Mr. Njai.
Thank you.
My name is Bigen Njai. I am from Jagle village. I have my business in Kaur. I'm doing cosmetics and salon. My business is different from the others because of the salon. My salon is the only salon in Kaur town. So anybody who want to prepare your head, hair dressing, makeup, eyelashes and all those, they will come and buy it from the shop and make it in the shop. Some people even call me that let me go outside of Kaur and make it for them. I charge them and go and do it. But you found me today, I have a special guest. We have a bride, and I guess it's very beautiful. She bought the mess there, she bought the eyelashes there, the nails, the makeup, the powder, and she's also going to pay for the service that we are doing for her. I will say thank you to you before I will start everything, because I can see the impact that the minigram did to my business. Because at the beginning, before I have the minigram, I was carrying bags, going around the Lumos, that is the weekly market selling. But when I got the minigram, now I have my own shop. So the 47,000 really did a very good business to me. I could remember after the Tabaski, I was having $80,000. So that $80,000, I started the salon from it and I saved something. So that is from there, I'll continue, I will be buying and saving. Presently, I'm having a good account with Nakop Credit Union. Through the Dominican, I was also able to employ one youth, that is the youth that we meet in my shop. She's doing the hairdressing, the fixing of eyelashes and the nails. I am paying her every end of month. And I'm also paying myself. And yet still the business is going fine. I know in the next 5 years to come, I will make it. I am hoping of employing 5 ladies. I am hoping even to separate now the business, because the salon is growing bigger now and the cosmetics is also growing bigger. I will be taking here in the Gambia to do the cosmetics and the salon. And I will make all the youth also to be taking here in the Gambia to do the cosmetics and the salon. We can do it and we will do it.